Welcome.
Thank you. So this is a first for me too, because I get to talk to a forum who's actually interested in what came out of these seed funds, which is still kind of in its inception, formative stages, and it's really exciting to share with you. In fact, sometimes when you make a PowerPoint presentation, you're like, oh, I got to get this all into words, but this time it was actually fun to think about what we're doing. So what is the best way to advance this with the keyboard?
The arrows? Yeah.
Okay, great. So it's really due to this center that we were able to fund this endeavor, and I'll give you an idea of where we are and where we're headed with it. This all came about because I had an interest, along with other people, in why puberty seems to be starting earlier in the United States and also in other developing countries and developed countries in the world. You've probably seen numerous media reports on this. Oftentimes they get part of the story right, but not the rest of it. And the other tricky bit is that underrepresented folks are almost entirely left out of this conversation. And my interest is specifically in Latino youth who are growing up in the United States who are at higher risk for going through puberty early. I'm specifically going to be talking about girls today for a lot of the empirical data on puberty starting early. Boys are just starting to be studied in more depth, but it looks like the same trend is also happening in boys. It just hasn't been as established for as long. So, as I mentioned, particularly in Mexican origin kids, those who were born in the United States, we see a higher risk for all markers of pubertal onset for girls, including breast development, pubic hair development, and first menstruation, compared to non-Hispanic white girls. African American girls tend to go through puberty the earliest in this country. We know that pubertal onset in girls is triggered by overweight and obesity, and that chemical exposures, particularly those that mimic hormones in the system, specifically estrogen, are potential culprits. Although that research has really been done primarily in animal models and is in its infancy in humans. Some other predictors that are lesser known of pubertal timing in girls are stress and instability in the family, low socioeconomic status. We just had an article come out in the Annals of Epidemiology showing that a number of low SES factors in statistical models take up a lot of the variance of what we often attribute to race. And that's really important. And then we also know that deprivation in neighborhood context, particularly in terms of opportunities to get out and get physical activity, seem to have an effect in certain ethnic minority groups on pubertal timing. Why do we care? So puberty starting earlier, so what? Well, early puberty in girls and also emerging evidence shows in boys is linked to a number of poor health and behavioral outcomes in adolescence, but also across the life course. It's also linked to higher all-cause mortality to go through puberty earlier. And part of the reason, I'm not going to talk about it today, that I have the breast cancer insignia down here is because one of the long-term outcomes associated with early menstruation in girls is a higher risk for breast cancer and also cardiovascular disease later in life. And that's part of how I found my collaborator. So I wanted to just give a mention to cancer outcomes. But let's focus on adolescence, because that's where a lot of my work is. I first became interested as a clinical psychologist working with Mexican origin youth in this topic because girls who go through puberty early are at much higher risk for depressive symptoms, depression disorder, anxiety, social phobia and anxiety disorders, problem behaviors, delinquency, earlier initiation of substance use, and also longer and more chronic substance use problems later. Early sexual initiation, not surprisingly, I guess, when you think about how sexualized puberty is in our society, and also body image issues and diagnosis of eating disorders. Now, most of these outcomes are already more prevalent among Latino youth in our country for a variety of reasons, and particularly as youth become more acculturated. And so that's where the intersection for me came about with the Latino youth that I was working with, both in Arizona and also in the Mission District. So that's where the collaboration began. Now, it began before we found out about the seed funding, which was just optimal. I can't believe the synergy. I met Camila Cordolan when we were at a NIH, a National Cancer Institute workshop symposium to bring together a bunch of puberty researchers that were working all over the world, specifically though under breast cancer umbrella. And I was actually, I think I might have told this story when we all met, but I was done with this conference. I'd already been there 3 days before, and we'd tacked on an extra 2 days for the symposium. And I missed my 2 kids who were both school age, and Camila came on the last day to present her research. And after I heard her speak, I caught her in the hall, and I'm like, we have to connect, because your cohort is just behind our cohort here, just by a couple years, and we have so much information we could share. And they had also tracked puberty longitudinally, which is very, very unusual. And she convinced me in the elevator to go out to dinner. I was already seeing if I could get on an earlier flight. And we ignored everybody else. We were at dinner with like 20 people. We ignored everybody else and talked for like an hour and a half over terrible Mexican food, which she thought was great because the Mexican food in Chile is apparently terrible. So, at any rate, let me dive in and talk about our cohort that we have established here. And then I'll talk about Camila's cohort. She's provided me with some slides, and I can't speak to it in as much detail because we're still getting to know each other's work. Then I'll tell you where we are right now with our collaborative endeavors. So CHAMACOS is a study that was started by Brenda Eskenazi. I'll give you some background on it. It's in the Salinas Valley. And it is, I'm not going to speak much today about the community-based participatory research aspect of it. It's multifaceted and really the way to do research. It's incredible, but it's too much for me to fit into this presentation. It is a true community-university partnership with give back to the community and investment with community members. If you don't know where Salinas is, it is located about 2 hours, exactly 2 hours south of here, because I drive there all the time, and I time it perfectly. And it's in between Castroville, Soledad. All of these cities are places where, or these areas are places where our cohort lives. They've been followed for, some of them have been followed for 15 years, so they've moved, but not too far. They all stay generally in this area. This slide is just to let you know what the prevalence is of agriculturally applied organophosphates. So I just want to set the context. This is a really high pesticide area, and this is why this sample was created, this cohort was created by Brenda way back when, because she's interested in environmental exposures. And you can't ignore the context of what we're studying these other risk behaviors in. So CHAMACOS is community-based, as I mentioned. 15 years ago, when the moms were pregnant, they were recruited in clinics, prenatal care clinics, so they all received prenatal care. That was one of the selection criteria. Brenda was studying, and her team were studying, and still are, the environmental chemicals that these women had been exposed to and the effect on their yet unborn babies and their health and development. I want to mention that Salinas is known as the salad bowl of the United States because it produces 80% of all the lettuces and salad stuff in the U.S. And less than 5%, around 5 or less than 5% of that is produced organically. So there's a lot of research that has come out of this cohort already on chemical exposures, and the reason that this was an important time to study in utero is that we know, whereas we used to think that babies were pretty protected in utero, we now know that that chemicals, pesticides, can get through the placenta and blood-brain barriers, probably along with a lot of other chemical exposures. And so this is also relevant to various hormone mimickers and other things that happen in utero that we won't talk about a lot today. And we also know that this is a critical window of susceptibility when organs are most sensitive to these things. So this is just to give you the context and the magnitude of the data that we've collected over the years. This is the years in which we gathered data on these youth. Starting in pregnancy, some of our staff actually saw the babies born. They were working in the clinica where we do our research, and they're still with us today, so they watched them grow up through the years. This center was funded up until 12 years old, and those were our last visits. And then I recently got a grant that started this year to then follow youth into 14 and 16 years old as well. So original enrollment was 600 pregnant women living in Salinas. Like I said, they were all receiving prenatal care, which removes the confound of people who don't get early health needs met. At any rate, they all had to be Medi-Cal eligible. You'll notice the selection criteria was not that they needed to be Mexican origin, but because the Salinas Valley is an agricultural area and we required that they be Medi-Cal eligible, I think 99% of the people were Mexican origin families. They had to speak English or Spanish. So these are the characteristics of the moms in the sample. About 80% of them still opt to take our surveys and be interviewed in Spanish. So that gives you a sense of this kind of slower rates of linguistic acculturation in this population, and also the fact that our bilingual bicultural staff make them feel very comfortable in deciding what they want to take the surveys in. And you can imagine a lot of it's done through interview because of the literacy rates. You can imagine that all of the youth opt for it in English. We don't even make a Spanish questionnaire any longer because all the youth were born in the United States. In the beginning, one thing that would be really interesting to study in this population, this sample, and Brenda has thought about this, is we know how they shifted linguistically. Like we actually watched the kids speaking Spanish exclusively when they were young, and we watched them kind of shift. And so she's done a bunch of neurocognitive work, and we could actually track that in terms of brain development, which could be another side note, could be really interesting. 44% worked in agriculture during their pregnancy, which we suspected, and 84% had people in the home. So you can imagine the exposure to pesticides, not just in the ambient environment, but also being tracked into the home and on clothing, et cetera. In 2009, so there was a large amount of attrition in the first 6 months of this study, not surprisingly, after the babies were born. And so by the time we got to 2009, there were about 330 people left in the sample, but almost no attrition since the babies were 1. So a really good, stable sample since then. At that point, Brenda enrolled 300 new 9-year-old girls and boys that looked very similar to the original cohort, and they actually don't differ on any of the characteristics, in order to look at puberty. And so that's where I came in. And that was right around the time that, if you can imagine, January 2009 was when I applied to work at UC Berkeley from UCSF. And Brenda was like, oh, you study puberty. This is so exciting. And we've had this ongoing conversation ever since, which resulted in this grant, which is great. Just to give you an idea of the multitude of information that has been gathered on these families. I mean, it's really, really a huge study. They have done a lot of neurodevelopmental assessment, which in and of itself is actually kind of a give back to the families, because the families want to know what's going on with their kids. Kids have been referred through the process. They've been given back details about their chemical exposures. It's been really an integrative kind of approach. And now Tanner staging has been collected since age 9, at 10 and a half and 12, and we're doing it again at 14, which is only slightly embarrassing to the youth, but they've been doing it for a while, so they're used to it. I'm sorry, pubertal staging. This is, and it's done by inspection, so it's not like how advanced do you think you are, which is what a lot of the research is, or circle a picture. It's actually by a trained endocrinologist. Our staff are taught how to do staging on people. And you would think that would be the most sensitive piece of this, because it's actually a physical exam, but I think they trust our staff and they really think of them as health professionals. So it goes okay. Tons of specimens are stored at our Richmond campus, and You can imagine why, because a lot of this is for chemical exposures, which you can get in a variety of ways. And nothing is perfect for any given class of chemicals, and so sometimes getting it from cord blood is the way, or maternal blood, or urine, or saliva, but there's evidence that things show up in the teeth and the hair, and so. Over 150,000 stored samples have been collected, and you can imagine the magnitude of tracking those and keeping them safe. It's a big deal. So I just wanted to show you, given that we've talked a lot about the background here, that kids in CHAMACOS, which is the name of this study, it means kids in Mexican Spanish, the pregnant women had a much higher level of these OP, which are the pesticide metabolites, as did their kids, than NHANES, which is national data, comparison to the national averages. But what I want to now draw us away from is a little bit from the chemical exposures, and also talk about, because the main aim of this early work was to look at neurodevelopment among kids, which you can see how that would be related to risk-taking and impulsivity and other things that could happen in adolescence, as we're talking about sexual risk-taking and things like that. All these other things that are also important in that mix. And what was so insightful for the team to do when they first started gathering data on these moms and their kids was to consider this whole larger macro environment. And they have all kinds of data, some of it that they collected just objectively on what was going on from census level, what was happening where the people were living in terms of what was around them, what surrounded them. They asked moms about discrimination and social support and food scarcity and just a variety of perceptions that can get under the skin, right? So not just the chemical exposures, which is what has made it such a rich study when you're thinking about adversity on multiple fronts. So some of these, interestingly, can determine risk and some resiliency. So we're also looking at what's protective. So what's protective in your family, what's protective in your practices that can also offset some of the risk, which doesn't happen a lot. It won't surprise you when you're studying Latino youth in the United States. It's often these real deficit models, these real risk models. So some of the things we are concerned about, though, from a risk-taking perspective is a lot of the folks live in these agricultural kind of housing complexes. Some, even though they're living in suburban tract houses that look nice from the outside, are crammed with tons of people. Housing density tends to be high. Maternal depression is off the charts. And so our staff spends a huge amount of time just counseling our families. And they're thrilled to have a clinical psychologist now come on, because we're really trying to get people linked in with services. As sad as the services are in this area, we're trying to form MOUs and try to get some traction around that. Food insecurity is very high, and we're actually measuring it again at age 14 to see how it is for the youth, which we haven't done. It's been mostly mom's food insecurity. We know that mothers will give up food to feed their children. So there's a lot going on there, etc. So, next steps. This is the new age of chamacos. They're turning 14. They used to be itty bitty. You can see the little guys, they're so cute. And that she's holding up the little shirt that her family got when she was born into chamacos. And now she's a big girl. This is during her 12 and a half visit, I think. The families are really committed. They really care about this, and they really want to know what the heck's going on, because they've seen people around them get cancer and have learning issues and struggle, and they're committed to this work. And they've gotten a lot of education about why this is not okay along the way, which we can talk about whether that changes our sample, and of course it does. Let's talk about Salinas and why I'm interested in adolescence and growing up as an adolescent in Salinas. It's predominantly Latino, mostly Mexican origin. About a third live at the poverty line or below of the people living there. About half of the students have subsidized lunch. A third don't graduate high school. In Arizona, where I did my graduate studies because I was specifically interested in Mexican American adolescents, half dropout. So Salinas is doing a little better than that, but not much. There's an exceptionally high teen pregnancy rate, which is one of the things I'm interested in. And it is a real dangerous place, actually. And it doesn't look it. If you drive around, it doesn't look it. And it's because of the gang involvement that's going on there. 10% of students report being in gangs. So you can imagine how many probably are, given that it's massively underreported. And almost everybody knows of someone or who is in a gang or is related to someone who is. And if you can believe it, Salinas is one of 6 high-risk communities that's been identified nationally for youth gang violence in the United States. So the whole purpose of what we're doing now, what I'm doing now, and there's lots of purposes to this larger study, but for me it's all about how do these adversities get under the skin to affect things biophysiologically, things like puberty, and also how youth respond to stress. And how does that neurocognitive piece fit into it to impact the life course of adolescents and adults? And what's protective? Even though you have this potential for high-risk outcomes, who's doing well? Who are the off-diagonals or the positive deviants, if you will? So at age 14 and 16, we're looking at a bunch of different outcomes. And I'll let you take a look at that while I look at the time.
We have 7, 8 minutes.
Great, okay. And we can talk more about these things. One thing we're doing is eliciting stress responsivity in these kids, and that's probably one of the hardest things in this study. I won't go into it right now, but getting kids to be stressed is totally against my nature as a clinical psychologist, but it's really important to this research to understand what's going on. We're also invested in learning about cultural norms like familism, religion, whether those are passed along from parents to kids or if they become sticking points with them, and also issues like virginity, and we'll look at sexual values as the kids get older. A lot of them have not initiated sex, so there's values, but they're hard to measure right now. We're also looking at a bunch of positive parenting and family factors. And we don't have the dads have been really hard to get involved in the work, but we're having the kids report on their dads. So for the first time, we're going to know more about Mexican origin dads, which is very unusual. But what little we do know from our work in Arizona is that they're really important, really important. So let me tell you a little bit about Camila's work. Their work down in Santiago is in English called the Growth and Obesity Chilean Cohort Study. So what they were doing was completely tracking obesity and growth. But doing the same Tanner staging growth anthropometry things that we were doing without all of the other stuff. I just talked about the socio-demographic profiles, the psychology, the mental health outcomes. They don't have any of that. And that's why we got excited and interested in talking to one another. They started when kids were in preschool. They have kind of a Head Start-ish. They have national preschool. And it's really easy to scoop up a bunch of participants through that who are going to subsidized preschool. So they started at 3.5 and went all the way to 9.5 until recently, and then they just got some recent funding to follow their youth. They got retrospective. They don't have report all the way back to pregnancy, but they got retrospective report at that point. And they also involved moms and kids. And by the way, both of these samples are boys and girls, which is really exciting because we don't know a lot about boys and pubertal development and growth. So they got funding again at a second wave. Now, I think it's important to note that there's not a lot of good examples of longitudinal research in Chile, not to mention this long of longitudinal research. And so they are really going it on their own, like in terms of learning how to set up a tracking system and retention and all of that. Incredible opportunity, I think, for them to say, how do you do this? And oh my God, we're so excited to see how you just keep a database on this and don't get confused, right? And how you do a community engagement piece to keep everybody in and how you give back to the community. Those things are pretty foreign to what they're doing. So this other grant funded them to 2012 when the kids were 9.5. And as you can see here, Camila and I met in 2013. They did get funded, and they have a multitude of studies to fund this. That's what all those arrows are. I'm not going to go into it. They have different studies funding different parts of this. And so their kids are going to be 14 and a half in 2017. So between 2016 and 17, their kids are going to be where our kids are by minutes. Great, perfect. All right, so none of that's important. This is where they do their research at University of Chile. Camila is in the Institute of Nutrition and Technology, and we have some other partners who are at Católica, and I'll talk a little bit about them. I'll show you pictures of everybody. Anyway, their studies are really focused on puberty. These are the Tanner stages. This is how we figure out what level of development people are in. At 1, there's no development, and at 5, you reach full maturation in terms of pubertal development. The girls and boys are taken into a room for evaluation. In our study, we invite the parents in as well, and I'm not sure if they do. We also have the parents report, and we get the parents report too, and we're interested, we're interested in how aligned the reports are with the actual physical Tanner staging. One thing that is very complicated with Tanner staging, and then I'll get off the nitty-gritty, is that when you have kids who are obese, it can look like they have breast development, and oftentimes they don't. And so it's really only by palpation where you feel the breast tissue and differentiate it from true true breast tissue from fat that you can tell. This is not done frequently, and so to find another study that was doing that alone is huge, because otherwise there's a whole lot of confounding issues with body fat. Gonadarche, we actually have to look at the boys' testicles and see how large they are. And this is an orchidometer, which shows there's specific sizes on there, because testicular volume is a huge measure. It's about the only way you can measure boys' puberty. They do skeletal maturation. They use DEXA to see what bone development looks like. Probably the most accurate measure of bone growth and age. So it's probably the best measure of puberty in some ways, but we don't do it in the United States with any frequency unless kids are being referred clinically. They take blood pressure, so do we. They do height and weight, and a bunch of other anthropometry measures, some of which we don't do because that's not the focus of our study. We all do parents as well, parents anthropometry to an extent, at least height and weight, and they do a bunch of other things along that line. And they do a 24-hour dietary recall, which we do not do. If you've ever done it, it's a total nightmare, so I'm glad we don't do it. We've done it in other studies, because their focus is really on nutrition, diet, and growth. And we do blood samples. They do blood samples like we do, except they wait until their girls are in Tanner stage 2 and 4. It's a different study design, whereas we do blood samples for chemicals, and then we use those for our, some of our puberty hormones. It means taking them in the morning, especially for estrogen, estradiol, which varies during the day. They take urine samples, as do we. So they have all these banked urine samples. They could actually go back and look at chemical exposures too, and that's something they're very interested in doing, although they've never thought about it before they hooked up with us. And they do a very slim socio-demographic survey. It does not have a lot of detail. There's a lot of regret there because we wish they did more, and now we're trying to figure out ways to go recapture some of those data. Their study, their cohort's very different because it lives urban. You know, everyone is urban, and so I don't want to disabuse anybody of the notion that we're talking about two similar cohorts because they're Latino. They're not similar at all, right? But maybe we'll put to rest some of the race conversations at least as we study the environment and see how much the environment contributes to these things. So at any rate, here's where we are. We're doing a cross-study comparison on some of the key descriptive variables, including those socio-demographic factors that we have, the stuff we have in common, the anthropometry, the growth, and particularly this puberty. Never been done to be able to compare across samples. It's rarely been done that participants have been tracked well long enough to even look at pubertal development in a cohort. Their kids are 12, our kids are 14. So what we've been able to do is inform a bunch of their data collection efforts so that we have analogous data going forward. But they've also asked us to put some scales in our ongoing data collection, which we're just doing right now, because they're interested in doing it later. So that's been really exciting. And they're taking on a whole new tack of trying to get at the psychology because they're already seeing problems emerge in their young people, and they're trying to get ahead of it, and they want to see what's going to happen at Next Wave. They've added 2 new psychology faculty from Católica to join in, so now we have a broader conversation that's more multidisciplinary, and we're going to talk with them a lot about our community-based model for outreach, education, and ongoing research involvement, retention issues. And the pesticide information I mentioned, they're also interested in. So I want to show you some pictures of when they came to visit us in August, and I'll point out who people are. So this is Loreto. She is a psychologist at Católica University. Camila's on the left, and we went down, and these are nutritionists and psychologists who basically came. The man on the right is one of the few people who is doing organic farming in the Salinas Valley, and he, which is why Loreto felt comfortable eating a strawberry right out of the field. He explained why it's hard. He talked about, he has a family farm that's been in the family for 3 or 4 generations, which he describes as very short. He's a short-termer, like new kid on the block, if you could believe it, even though his grandfather, I think, was the one who started it. And it was revolutionary in the 80s when he and his brother decided to start converting parts of it to an organic farm, and now it's totally organic. It's very small. He's right up against, I think you can see it behind him, he's right up against a huge, not conventional farm. So you can imagine like boundaries and spraying and how they manage those things, and wind. They actually manage the wind and currents. And it's hard to maintain your organic status. You have to know your neighbors and you have to be close to them. And he actually said that his neighbor's great. He's one of the biggest farmers in the Salinas Valley, and they treat their workers really well and pay them really well, despite the fact that they use conventional methods. So there's all these levels to, it's not just you're a sprayer or you're not, there's all these levels to community in this area that go way back. Now they mentioned that you would never eat a strawberry out of a field in Chile, ever. And in fact, moms are constantly chasing their kids out of the fields, not because they don't want them eating the food. And I think that goes back to a long history of knowing that you have to wash the food before you eat it for various reasons. And so they were mentioning that there's no studies of this pesticide exposure, and it's probably really important. A good thing to know that we learned is that organic is organic is organic. So if you buy organic fruit from Chile, it's actually, it conforms to the organic criteria that we have in the United States here. So don't be suspicious of it. It's good. They met our staff. They met our youth collaborators who came and did presentations for them about the work they're doing in the community around beauty products and chemicals in beauty products. So we have some amazing youth who go out and educate the community. They actually visited our biorepository in Richmond. They were blown away. I was blown away. I didn't know where our samples went. It's an amazing, amazing exercise and organization that's run by Nina Holland, who's in our School of Public Health, and only a Russian could keep this on track so well. She is like just meticulous. It's beautiful. So much work. And now this is where we're going to go in December, thanks to our seed funding. They came out to visit us, learned a lot. We get to go out and visit them and learn a lot as well. And these are the researchers here in the School of Public Health that are going to be going. Brenda Eskenazi is at the top. She started the Salinas cohort. Kim Harley was hand in hand with Brenda, has worked on this cohort forever. She's faculty in the School of Public Health and now has started a whole other study that's ongoing right now on adolescence exposure to endocrine disrupting chemicals through personal care products. And she's the one who does the youth participatory research where she teaches, they train the youth and the youth go out and deliver the message. Asa Bradman has done a lot of the chemical exposure work in this study, and Kimberly Para is the only reason that we can keep our field office alive, because she's down there. She's our field office coordinator, and she's down there running the whole thing. And I can tell you that when our research friends from Chile came, she's the one they wanted to talk to. Mm-hmm. They wanted to know how this was working in the field 2 hours away from the university. Mm-hmm. So she holds the golden keys, and they don't care about the rest of us coming. They want to see her, because we had to tear them away. I'm like, there's going to be tráfico, we got to go. And they're like, no, one more question. I'm like, you can email. So I just need to thank all the people, that I can't even name them all, who are involved in this project, the multitude of grants that have kept this alive, and to you guys for providing this opportunity, because it's been exceptional. And I'm happy to take questions. How did I do on time? Okay, 15 minutes or so. Oh, right on time. 12:45. Yeah. Yes.
At first, I want to share your enthusiasm for how great it sounds like this collaboration has been. So I'm really happy that.
Oh yeah, and so I didn't say, I came back, and your announcement came out 3 months later. We said, let's find a way to support our work, and it came out 3 months later, which was shocking.
Yeah, I'm really happy. So you shared an enormous amount of really interesting information, and I'm just curious. If there have been if you can share some of the real unintended consequences of what's happened with your cohort in Salinas, because it sounds like they have had to become sort of advocates for themselves in a way, with all this information that they're learning from the study that they're a part of. So if you can just talk a little bit about that, both the youth and the mothers.
There's so many that it's hard to even figure out which to focus on when you think about the fact that this team has been involved in these families' lives, 600 plus youth, half of them for 15 years, So there has been, there's been domestic violence, there's been issues around trying to advocate with your employer for better hand washing. There's been, now with youth, there was a recent suicide intervention that I had to do specifically with the youth. I would thank God I have a license that's active, because it meant going down and sitting with this youth for 2 hours at a time to make sure she was okay. So this is real life, this is not hands-off research. I think one of the big things that I would share that's been hard, there's lots of things that are hard about working in a community fashion where Brenda has involved not just the kind of the farm worker unions and the folks who are advocating for the families and the people in this area, but also involving the growers to create dialogue at the table. There's been all kinds of tensions there, and she does an amazing job of balancing everyone's needs. And there's individuals within those organizations who really reach out across them to make this work. But I think one of the hardest and saddest things that I have talked to Brenda about is they realized that for a fraction of money, you could bring out hand washing facilities that provided warm water to the fields that were transportable and solar powered. And for a fraction of the cost, you could make that a reality, that were weather resistant and could be useful. Now, why is that important? Well, if anyone paid attention, they would learn that most of the farm workers don't want to wash their hands in cold water. And I don't know if anybody here knows why, but it's because there's all kinds of handed down stories about getting arthritis from washing your hands in cold water, and that being unhealthy or causing colds, and it being not a healthy thing to wash your hand in freezing water, which is what the water would become out in the fields, particularly around certain seasons. And so a really obvious intervention, once you have that information in your head, is to try to bring out portable facilities for warm water, fraction of a cost. They got a bunch of them going as a pilot. Brenda pushed hard with local advocacy, and it was not a fortune. I think it was like $1,000 some for a huge amount of, bang for the buck. And they worked. They collected data. It worked. More people were hand washing. And there was no sustainability. There was no uptake. And I think those kinds of things, I don't know if that's what you were thinking of, but on a macro level, those kinds of things are devastating. When you know something works, you know it's affordable, you know it can be done, and it doesn't gain traction.
Thank you.
Right? Yeah.
So you mentioned that it was hard to get the fathers involved in the study, but that from what you were learning that they were really important. Could you elaborate on that a little bit?
So like much of the research I've done with families in general, but particularly with Mexican origin families from outside the United States, dads will often come and check things out and make sure everything's kosher, and they'll come for the first few times, and then they're like, oh, you're good, I'm out. And I'm gonna go do the other stuff I gotta do. And so Brenda had similar experiences here, was that the dads were totally invested, but they're like, okay, I'm happy to play a supporting role while you all come to the clinic and do these onerous tasks. And a lot of it is just the reality of having to work, right? So it is very hard even to get just the mom and their kid in at the same time. It's a real challenge. And right now, particularly with the kids being older, I mean, some of our families don't get off until 6 o'clock, you know, or they're going into the fields at 4:30 in the morning. I mean, we've always had real struggles. But now that the kids are also involved in other things, it's harder and harder. So one of the things we do in this sample, and I'm diverging a little bit, is collect cortisol, and it has to be collected within a certain window of time. It's a stress hormone. And so we're having trouble keeping them even within the window of time because we have to get them in by 6:30, or it's getting too late at night, and it cycles. So dads, we can have moms report on dads. We can have kids report on dads, and at least that gives us some perspective of what's going on. And it's the best that we've found we can do with the resources it takes to track our participants, which is really expensive and hard. We get them all back, you know, a lot of them. I would say our attrition is way less than 5% per year, maybe 3%. They know us and they love us now, but they're not going to get their husbands or their dads or their partners in. Why is it important? What we have found in some of our other studies in Arizona with Mexican origin families that are probably more similar to these families than the Chilean families, right? Is that moms put a lot of energy in to raising kids, and dads are highly variable. And so you get dads who are super invested emotionally, have real communication, close connections with their kids, and there's a lot of variability on the other end. And so we found that because of that variability, there's a bigger bang for the buck sometimes. When we are able to get dad's data, it seems like it really pops in the models. Whereas when we ask about maternal warmth, for instance, like 90% of the moms are warm. Even if they're also conflictual and angry and fighting or whatever, the moms are warm. But dads, they can be pretty emotionally distant sometimes. And so we get a wider range, right? So not getting those data is missing a whole picture. When there is a father in the home, or even a relationship with a father who's not in the home, it's a harder picture to get, but important. And we know it's important with puberty, too. We've shown that dad's involvement during the pubertal years, which is when a lot of dads withdraw, regardless of race, ethnicity, can be a key protective factor in girls' outcomes.
Can you talk more about the collaboration with Chile and what the next steps are?
Yeah, that's about all I have so far, is that we're going to do some comparison of our data, see how similar or different it is, hopefully publish that. That would be the next step, because those data are nowhere, just even tracking and comparing. As I mentioned, we're going to try to get some analogous measures in both studies, and then a great deal of the time when we go down in December, early December, is going to be spent thinking about what can we do? What grant can we write next to try to do more? What can we add? I know they're really interested in adding either a youth participatory research component or a community-based outreach component. Very, very hard to get funded down there. They basically said you can't. So if we could find some NIH funding to do some cross-fertilization there, it would benefit their sample, because will benefit them because they could keep the people in their sample longer. It's very, very hard to keep a sample through adolescence, because adolescents start having their own opinions about whether they want to come in or not, and what's in it for me, and those kinds of things. One thing we know is that before adolescence, youth are really committed to like the scientific idea and giving to science, and to just as their parents are. And you know, we have lots of studies showing it's not compensation. It's really what people think is valuable, and the staff are key, and those kinds of things. Well, what we have learned with youth is that youth want compensation. To get them over that hump, and then once they get a little older, then they're back to like, oh, it's good for science, and I like you people, and I'm going to do it out of the goodness of my own heart. So youth respond to swag, they respond to gift cards, they respond to things like that. So some of it's around what does adolescence mean, and how is it different retaining a sample through that time, and how can we help you? And the other piece is we just have an opportunity for such interesting. They have, over 1,000 youth in their sample, and we have over 600. So any way that we can find some, analogous data to compare, we have a really nice sample size to look at some things, and we don't know what they are. So stay tuned. We'll see.
Doesn't Brenda Ashkenazi also have a study in Costa Rica on?
Just emerging, yeah, an emerging study. I don't know a ton about it, but I know that her doctoral student, I think Ana Maria Mora, is that her name? I can't remember her first name. She's a Mora. I have a Mora in my family. That's how I remember her last name. She has just returned back to Costa Rica, and I know that she and Brenda have been cooking things up for a while, so I'm not sure what stage it's in.
I'm just curious if they were going to have a similar sort of longitudinal thing.
I don't know, but Brenda does have one in South Africa. It's called the Vembe Project, where they're looking at, and there it's a whole other set of circumstances where there's a ton of malarial spraying going on with things that have been banned in the United States. And so there's that tension, that public health tension between the impact of malaria, which we know is very real at young ages in terms of mortality, and the issue of then what are the neurological effects of that spraying. And they spray right on people's huts where they live for malarial prevention. And that is absolutely a longitudinal study, and Brenda has been known to take laptops on the plane and storage cases for specimens, and she goes back and forth and works on that quite a bit. But yeah, her center is, and she has a project in Italy. So her work in terms of environmental exposure spans the globe at this point. But I would talk to her. I would email her about what's going on in Costa Rica.
Chile has pesticides that aren't allowed here, right?
I'm not sure. That's one of the things we're going to talk about when we're down there. And that's why Asa is coming down with us. We added Asa later because we were coming down with a bunch of adolescent folks, so to speak. And Asa is a chemical exposures guy. And so part of the reason that we wanted him to come was to communicate with the people down in Chile who aren't even necessarily part of this team, but have interest in environmental exposures. So that's one of the unintended consequences that came from this collaboration, was to look at a whole nother area. Also, a lot of interest in the beauty product stuff. So when these researchers were here, everybody, it's interesting, just a little anecdote, oftentimes you'll buy personal care products here in the United States because they're easier to get and less expensive, and bring them back down to Chile. And that was one of their last days here was a shopping trip to get the things they wanted. And we had introduced them to an app by the Environmental Working Group where you can shop smartly for your beauty products and personal care products to see if they're how they're rated on this app. And so everybody was running everything across the barcodes to see how it was. So there's a lot of interest in both of those areas, the pesticides and personal care products. But in terms of what is still going on, what's still being used in Chile, I'll know more about that when we come back. I know more about chemical exposures than I ever thought I would as an adolescent psychologist. And then next steps for CHAMACOS as the kids get older is to really look at the whole picture. The chemical exposures, the fat. We know that fat stores chemical exposures, the neurocognitive development, how that leads to risk-taking, how that leads to stress reactivity, impaired judgment, delinquency. So Brenda's now writing the next iteration of our center grant, which has a huge juvenile justice focus and delinquency focus. Because we know how much the victim gets blamed in this culture, and to be able to track things back to early life and things that are done unto people that change their trajectories is super sad. I mean, I think all of us are, it's really hard for everybody involved from a personal level, but to be able to track that and then have some hard data to advocate, especially when we're talking about the brain right now and biophysiological effects like puberty, like you're shifting people's puberty early, then we have more traction to really tackle the social justice issues that are obvious in this population.
I have one just last question. I think it's coming off of the comment you just made now.
Sure.
That going back to your first slide where you said this is why you first got into studying this topic. Do you feel like this specific research project is getting you kind of close to answering some of these real questions in a way that puts you in a position to maybe advocate for
That's a good
some
question.
of these things?
Yeah, you know what? It's done a couple things. It's put me in a better position. It will put me in a better position to advocate, but it's opened my mind a lot as to the number of levels we have to advocate on. You know, and this is probably true of anyone's career, that when you start really small. And I was thinking about puberty and depression in girls, puberty and early sexuality, puberty and pregnancy. That's what I was seeing, and that's what I was reading. And as I started to back up, I realized, wow, thinking about these things and starting to think about them in adolescence is way too late. Like, not that that's not, we don't want to intervene there, we do. But we need to start thinking so much earlier in terms of the cumulative risk that people are put at. So I never would have thought chemicals, and I never would have thought some of these, and I never would have ended up working, you know, in intergenerational transmission of risk, you know. So I think there's so many places that we can do more. You know, it's one of those situations where we're not doing much. So there's a lot of space for movement, for sure.
Great.
Well, this has been,
Sure,
I know
sure.
as you were saying that you were also looking for what were protective things and what were positive deviants. What were just a couple things that you found?
We don't know yet.
That
It's
you
really
learned about?
exciting. I mean, what we know from the literature is having, in very early life, at least psychologically, having a very strong family base. So consistency, warmth, stability, that even if the outside world is spinning around you, and it's a lot to ask because it's through the parents, right? That kids can really be protected psychologically in that space. But then how do we leverage like the strong Latino values? How do we leverage the social support? How do we leverage kind of the psychological nutrients to empower parents to protect their kids? It's expecting a lot of parents, but I think if we can figure out who's doing it and who's doing it well and why and how, then maybe some of that's packageable in terms of intervention, at least at the family level. Like I said, there's multiple levels. We should be backing up and changing the social context for sure. But that's one example of what we're hoping to find, like where's the bang for the buck, where's the power, and when, since we have this longitudinal cohort study. What we find in this sample, and it was one of the potential criticisms from NIH, is, well, everyone's poor. How are you going to study adversity in this sample? Well, guess what? We went in and looked at depression and various markers of adversity throughout early life from 0 to 5. And in terms of how it was getting under the skin already, wide variability. So some people are tanking, some people are actually pretty darn resilient. And so we want to know why and how.
Well, this has been really, really interesting. And thank you so much
Oh, my
for
pleasure.
coming to get this talk.
That was great. Thank you very much.